So welcome to Safe Shore Care's training videos. We're now going to do a mock assessment station using the ectopic pregnancy scenario. So this is a 20-minute scenario. First of all, examiner, I'm just reading my notes that I've been given about my patient. So it's an Emma Thomas, a 30-year-old lady, admitted from A&E with abdominal pain. She's having an ectopic pregnancy. She's nil by mouth and she's undergoing a sapropharyngeectomy. She's got a partner called Tracy. Came pregnant 14 weeks ago. So the scenario wants me to perform a A&E assessment and do vital signs using a National Early Warning Score chart. It's 10 o'clock today. The date is the 5th of August. Looking at my patient history. Suffers from depression as well. 3 courses of IV treatment, so that's going to be important to think about. Non-smoker, previously unemployed, and she's on ferrous sulfate, citalopram and paracetamol, and she has some allergies. Alright, so I've done my quick read beforehand, so I'm now going to be entering the room. So I'm coming into the room to my patient. I'm observing the scene, but there's no trip hazards, it's safe to enter. And then also, hello, are you Emma Thomas?
Yes.
Yeah, I'm Mandy, I'm your nurse for today.
Yes.
Is it all right if I come in and have a chat with you and do some assessments on you?
Yes.
All right, so first of all, I'm going to do my hand hygiene. All right, in accordance with the 5 moments of the World Health Organization hand hygiene. It's a 7 steps, so first, palm to palm, rubbing my palms together. Going to interlock my fingers, right hand on top of left hand. Left hand on top of right hand. Then going to put my hands together with my fingers interlocked. Going to interlock my hands and rub my nail beds together. And again the other way. Then I'm going to take my nail beds and I'm going to rub my nail beds into my palm and swap over. Then I'm going to take my thumb and clean that, and the other thumb. And I'm going to clean the wrist and clean the other wrist. And then I'm going to let them dry for up to 30 seconds. So, Miss Thomas, what would you like me to call you today?
Emma is fine.
Emma's all right, is it? Lovely. As I said, I'm Mandy, I'm your nurse for today. So I just want to first of all do an ID check if I can.
Okay.
Can I just have a look at your handband? And can you tell me what your full name is, please?
Emma Thomas.
Yeah, that's right. Lovely. And your date of birth?
Is January 1st, 1994.
Yeah, got that right. And we've got a hospital number here of H0004321. So I can confirm I've got the right patient. I also noticed you've got a red armband on there, which is an allergy band. What are you allergic to?
Penicillin and plasters.
And how does it affect you?
I get rashes.
All right, well, we'll make sure we don't use any of those through today. All right, so as I said, what I need to do, just going to give my hands another quick quote. I need to do some assessments on you.
Okay.
All right, and do some vital observations, your blood pressure and pulse, things like that. Do you need to go to the toilet at all before I do that?
No, I'm comfortable.
Take about 20 minutes if that's okay.
Okay.
All right. And what about comfort-wise? Have you got much pain at the moment?
Definitely hurting a little bit.
Yeah. All right. Fortunately, if you've had any painkillers, I'll have a look. If not, I'll see if I can give you. Do you want anything now?
I'm okay. We can finish the assessment.
Sort of on a score to what, 0 to 10? 0 being no pain and 10 being the worst pain. What is it at the moment?
6 or 7.
All right. Well, please let me know. I'll stop if I need to get you some. Go and have a look at your analgesics. But it probably might not ease until you've had your surgery anyway. All right. So I notice you're nil by mouth, and we're just going to be getting you ready for surgery. All right, today. So first of all, I just want to do some assessments on you. I can see that you're talking to me, which shows me that your airway is open, so there's no obstruction. And anything wrong with your throat at all? No, everything seems clear. So that seems to be fine. And what I'm doing now is just assessing your respiratory pattern. And I can see that you're breathing reasonably regular. I'll actually take the respiratory rate in a moment. But at the moment, you seem to be reasonably regular. The depth seems to be good. Have you got any cough at all at the moment?
No.
All right. And can you just take a nice deep breath in for me? In and out. All right. No wheezing or anything. Not had any breathing problems at all. No. So I can really determine that you've got no respiratory distress there. All right. What I am going to do is can I just examine that my equipment is all calibrated and ready to use? Yeah, it is lovely. What I'm going to do is just put this little device on your finger, measures your oxygen levels that's in your blood. So if I can choose any particular finger, or fine, just pop that on there for you. All right, and I'm just going to have a look at your finger. There's no problems there. There's no nail varnish, so it should give me a nice clear signal. So that'll just sit on there for a moment. All right, and then I can write your saturation levels down. And that's good. So that's 96%, which actually shows you've got good oxygen levels. Therefore, that's your respiratory chart's finished. And I'm just going to add it to my chart here. All right. So I'm just now going to come in. Is it all right if I do your blood pressure?
Sure.
All right. So I'm going to put a cuff on. Is there any preference of which arm we use?
No, either one works.
You had any surgery on any of your arms?
No.
There's no edema that I can see. So what I'll do then is, if I can take this cuff, I'm going to put this cuff above your brachial artery, about 2 to 3 centimetres above your cubica fossa. All right, and nicely there. It'll get quite tight, and it's covering at least 2/3 of your arm, so that means the cuff is the right size. So just try and keep your arm straight there for me, and that'll get tight. Is that getting tight? Lovely. Can I just have a look at your other hand there a minute?
Yes.
What I'm going to do is what we call a capillary refill, which is just check your circulation. I'm going to squeeze your finger for a couple of seconds and then let go, and the colour should come back within 2 seconds. So I'll squeeze it for 5 seconds. All right. And then check your that it comes back within 2 seconds. All right. So that's going to get tight there for now. So your cap refill is fine, showing that you've got good circulation there. And I can also see with your colour, you've got good colour in your skin. There doesn't seem to be any blueness around your lips. You're not pale. We have to watch out for this, that you don't go into shock and start bleeding. But your skin looks very good there. All right. So that's your blood pressure, which is 116/76. I'm just going to transfer that to this chart. All right. So what I want to do now, I'll take that off you. Is it all right if I check your pulse?
Sure.
Yeah. So what I'm going to do is check your pulse. All right. I'm going to do a radial pulse. Let's turn that off. My hands are clean again. Lift your hand up there. Just going to check that. Just going to have got my watch there. I'm going to put it on there if that's okay. And I'm just going to take your pulse for a minute. Right, lovely. That seemed probably quite a long time. I was actually doing your pulse for a minute, but was also recording a more accurate respiratory rate for a minute. Didn't like to tell you because it can affect how quickly you breathe. So we've got a pulse rate there of 76 and a respiratory rate of 14, which are both within normal levels. So, and also your pulse was very regular. There's no irregularity, misbeats or anything. Quite regular when I was taking it, and a good strength on it. So you've got a good beat there with your respiratory rate. Right, so just coming on, can you tell me where you are today?
I'm in the hospital.
Yeah, and you know roughly what month is it at the moment?
It is August.
Yeah, all right. And what country are you in?
The United Kingdom.
Yeah, right, oh, good, Lex. So I can confirm you are fully alert. And your pain at the moment, you said you've got a bit of pain. What sort of pain is it? Is it quite sharp?
It's pretty sharp in my right side.
Is it there all the time?
Yeah, since it started, it's.
And you said it's what level on a scale, 0 to 10?
A 6 or a 7.
I don't know. All right, so that's all right. So we will get you something if you need it afterwards. All right. Now, are you going to the toilet? All right. Have you got any urgency with the pregnancy or infections?
I feel like maybe peeing a little bit more, but not.
All right. What we might do later is just take a specimen just to check it.
Okay.
All right. For any infection or anything, but not unusual to have infections, unfortunately, when you're pregnant. But once you are allowed to eat and drink, just make sure you drink plenty.
Okay.
All right. And what about having your bowels open? Has that been affected at all?
No, it's been pretty normal.
Right, great. Oh, and with your urine, have you noticed any blood in your urine? Is that what you picked up on? Huh?
Yeah, a little.
All right. So yeah. And do you know whether you've had a blood sugar taken at all?
Yes, they did take one.
Yeah. Examiner, can I confirm what the last blood sugar was? All right, so 6. That's good. Right. All right. So just a last observation that I want to do now is just do your temperature. All right. So what I'm going to do is just shine this device just at your forehead, and it just does a temporal thermometer. And you've got a temperature of 36.8, so that's within normal range as well.
All right.
So just going to give my hands another clean. So what we're doing, Emma, is we're writing on your vital signs that we've just taken, all your observations down on what we call a National Early Warning Score chart. So at the top of that chart, I'm putting your name, Emma Thomas, your date of birth and date of admission. And on top of the first column is the 5th of August, and it's 10 o'clock in the morning. So we're writing down all the vital signs that we've taken in the appropriate parameter boxes. And we've also got you on room air, so that also scores a 0. So what we do is we look at each of those parameters and give them a score on based on what the levels are. And as yours are all normal, each of your parameters have scored a 0, which we would add those scores up. And for yourself, we get a National Early Warning Score of 0. Which means that when we look at the escalation chart, that we only need to do your observations every 12 hours, and we don't need to escalate them to a doctor. So we'll just keep an eye on you. As you have had an ectopic pregnancy, although the score says that we only need to do them every 12 hours, we will actually record them every 4 hours, just because of the fact that you've had an ectopic pregnancy and the risk of you going into bleeding and shock. We want to keep an eye on that. And we may even escalate those and do them more frequently if we feel we need to. So that's how we record your observations. So you can be assured that we're happy that you're fairly stable at the moment. So we'll now just come and do some further questions if we can. So just with your skin now, Stuart, if I just have a look at your skin and expose you. All right, so yeah, it's all right, examiner, I won't expose you, but have you got any cuts or bruises on your legs or your arms?
No.
All right, we'll just have a look at your legs, because sometimes when you're pregnant, your legs will swell up, but there doesn't seem to be any edema there, so they look nice and colour. And like I say, you've got good colour there, so no bruises, no injuries. Past medical history, I do notice you do have a little bit of depression. How is that been at the moment?
It was doing better when I got pregnant, but it's feeling pretty rough today.
And I can see you on citalopram for that.
Yes.
Do you know whether you've had that today?
Yes, I took it this morning.
All right, great, good. We also noticed you want some ferrous sulfate iron supplements, and there's some paracetamol written up for you. All right. Well, listen, after you've had the procedure, obviously you're going to lose the baby. Would you like to get somebody to come and talk to you about it?
Yes.
Yeah. So the gynecology team should come and see you anyway before surgery, but we'll get them to come out and chat with you afterwards, because you've had a few treatments of IVF, isn't it? So, and we'll get someone. But if not straight away, then in the next few weeks, we make sure you get contact with your GP and you get contact with your gynecological team and get them to chat to you over that. All right. So when did you first notice a problem with the baby?
This morning I started having some bleeding and the pain started.
Right. But other than that, are you normally physically active and unwell?
Yeah, I get around fine.
Good. Lovely. So as we said, you've obviously got the depression, so we'll get someone to chat to you and make sure they keep you well informed. And you've got a partner, have you? Is she around at the moment?
Yes, she's supposed to be coming in as soon as she can. She's at work.
So let us know if you want us to chase that up, because we'll obviously try and get her here before you go for surgery.
Yes, that would be great.
All right, and also to chat to her as well.
Yes.
Have you got anybody else that supports you at this time?
My family's kind of far, but I keep in contact with
them. All right.
phone.
Any spiritual support that you have, or anything you follow, or no? All right. Let us know if you do, and then, as I said, we'll get in touch with the gynecology team for you.
Okay.
Thinking of something. Do you have any other questions at the moment?
No.
Main thing also, you obviously nil by mouth, so you can't have anything to eat and drink at the moment.
Okay.
So please let us know. We can get some sponges for you to wet your mouth.
Okay.
But you just can't eat and drink anything. And the anaesthetist should come and see you shortly and go through a few pre-operative checks. Okay. And we'll start to get you ready for theatre. All right. So is there anything else you have any questions over? Or concerns?
No, just maybe something for pain.
Yeah. All right. So I'll make sure you've got some painkillers. I'll bring those back for you. But if there's nothing else, I just want to make sure you've got your call bell there. Please use that if you need me for anything else. But at this point, that's the assessments that I need to do finished at this time. I'm just going to give my hands just a final clean there and examiner. My assessment of this patient is now completed. So hopefully you found that useful. If you enjoyed these videos, please subscribe to our channel and write any comments in the tabs below, and we look forward to being able to produce more videos for you. So watch out for further videos coming out from Safe Shore Care. Just to let you know, we have our OSCE training once a month in Morden, South London. We'll prepare you for your OSCE exam. We've got excellent team on offer. Myself, I've got 35 years nursing experience. So look out for our dates once a month in South London, and we will help you have the success in getting through your OSCE exam in the first attempt. So watch out for our videos and subscribe to our channel.